Tuberculosis, commonly known as TB, is a chronic infectious disease caused by a bacteria called Mycobacterium tuberculosis. It mainly affects the lungs, but it can also involve many other organs of the body. Pathology of tuberculosis in the lungs. TB bacteria enter the body through the air we breathe. After inhalation, the bacteria reach the air sacs of the lungs, known as alveoli. Here, they begin to multiply slowly. The immune system reacts by sending white blood cells to fight the infection. These cells surround the bacteria and form small protective structures called granulomas or tubercles. At this stage, the infection may remain latent, meaning the person has no symptoms but still carries the bacteria. If the immune system becomes weak, the bacteria become active. The granulomas break down, causing inflammation and destruction of lung tissue. Gradually, soft cheesy-like material called caseation forms inside the lungs. As the disease progresses, cavities develop in the lung tissue. These cavities reduce lung capacity, disturb oxygen exchange, and make coughing more severe. The damaged blood vessels may bleed, leading to blood in sputum. Spread of TB to other organs, extrapulmonary TB. If TB is not treated on time, the bacteria can spread from the lungs through the bloodstream or lymphatic system. Lymph nodes become enlarged, painless, and may discharge pus. Bones and joints cause chronic pain, swelling, and difficulty walking, especially spine TB. Kidneys lead to urinary problems and blood in urine. Brain TB meningitis causes headache, fever, confusion, and neck stiffness. Intestines cause abdominal pain, diarrhea, and weight loss. This form of TB is known as extrapulmonary tuberculosis and can be life-threatening if untreated. Signs and symptoms of tuberculosis. TB symptoms usually develop slowly and are often ignored. Common symptoms include cough lasting more than 2 weeks, cough with sputum or blood, low-grade fever, especially in the evening, night sweats, weight loss and loss of appetite, persistent tiredness and weakness, chest pain and shortness of breath. Prevention of tuberculosis. TB can be prevented by simple protective measures. Always cover your mouth while coughing or sneezing. Use a mask, especially if you have a cough or are diagnosed with TB. Proper ventilation is essential. Fresh air and sunlight reduce the survival of TB bacteria in closed spaces. Early diagnosis and complete treatment are the most effective ways to stop TB spread. TB medicines must be taken regularly for the full prescribed duration. Incomplete treatment can result in drug-resistant TB, which is difficult to cure. Vaccination against tuberculosis. The BCG vaccine, given at birth, helps protect children from severe forms of TB, such as TB meningitis and widespread disease. A small scar on the upper arm after vaccination is normal. Community awareness message. Tuberculosis is preventable, treatable, and curable. Prevention is better than cure.